It is estimated that 1 billion people perished in the multitude of wars throughout human history. Yet our understanding of the psycho-emotional toll is relatively new. At the time of the Civil War, it was called soldier's heart, while in World War I, it was referred to as shell shock or combat neuroses. In World War II, it was called battle fatigue. After World War II, tens of thousands of soldiers were hospitalized with psychiatric problems, the majority being diagnosed as paranoid schizophrenic. In the post-Vietnam years, there was more understanding of the real problems, and the attitudes began to change, but it was not until 1979 that the Veterans Administration recognized the need to develop treatments specific to the individual veterans. In 1980, the American Psychiatric Association recognized PTSD as a legitimate medical diagnosis. Now the world is again at war, but this time with COVID-19. And if current estimates prevail, this pandemic will be the third highest loss of American lives after those lost in the Civil War and World War II. Jonathan Shea, a VA psychiatrist who has written extensively on PTSD, says, "If a soldier has experienced a betrayal of what is right by those in charge, his capacity for social trust can be impaired for the rest of his life." How then shall we answer our frontline care providers and first responders who we sent into battle largely unprotected against COVID-19? We call them heroes, which they certainly are, but it is also partly self-serving, as it makes us feel better to publicly praise their courage, knowing that they may pay the ultimate sacrifice. Their PTSD isn't a disorder resulting just from their long hours and horrendous work, but it is also an issue of moral injury and betrayal. We have developed the coronavirus rapid de-stress protocol from our decades of experience by training military healthcare providers to use acupuncture instead of drug cocktails to treat PTS and its sequelae. We have seen the remarkable benefits that a few well-placed acupuncture needles can rapidly bring those rendered dysfunctional by PTSD and the side effects of multi-drug therapy. Rather than limiting the support of our frontline colleagues and support staff to calling them heroes, we should be providing them the care they need for the significant sacrifices they are making for all of us. Will you join us and learn how to administer CRDP treatments to truly help our frontline heroes? Thank you.
Calming and centering. This is the outcome you can achieve using the COVID-19 Rapid De-Stress Protocol. As you have witnessed, our frontline healthcare workers have been through a great deal of stress as they've witnessed patients in a state of declining health due to the COVID-19 pandemic, difficulties in operating with proper protection, with proper staffing, with proper equipment. And while it can be frustrating, there is still a sense of duty, there is still a sense of commitment, and there is still a sense of an ethos of helping the greater good. Please continue to use and study this technique, as you will find it very helpful in providing relief for your coworkers and others, family members, friends, that are experiencing undue stress. These circumstances have also affected people in the sense that they are more isolated. There's a lot more fear. There's economic turmoil. And so trying to achieve a state of calm and centering is very important to be able to endure the long duration we have to overcome this. Part of what we mean when we talk about calm is a reduction in anxiety and the sleep that is disruptive with insomnia, with nightmares. Another aspect of calm is diminished adrenergic drive, reduced hypersensitivity, and hyperactive behaviors. These are very important for us to move forward and allow our bodies to achieve optimum health. When we talk about centering, it's that psycho-emotional component of regaining control of our lives, our current state, and our future. Ability to think clearly and focus and make the plans that are necessary to overcome this difficult time, as well as regain meaning in life. You all have committed some time to watching our videos, and we hope you will proceed with reaching out to us and participating in a live webinar where we can teach you further, answer your questions, give you encouragement and the strength to be able to use this technique to help your patients, your family, and to take good care of yourselves. Now go do good work. Thank you.
In these unparalleled times, healthcare providers are on the front lines, the warriors. The tools we have gained from our experience working with the military and wounded warriors can be used to help healthcare providers, to help one another to relax, to cope, to sleep better, to smile again. This is something you can do. This is something you can receive. I urge you to consider this opportunity for your colleagues, for your team members, and for yourself. Use this with a sincerity of purpose and help us, help one another at this time of crisis. Use this with love in your heart.
We've tried to make this presentation as clear and comprehensible as possible. We sincerely hope you can find the time and the headspace to really learn this treatment protocol. It'll be worth the effort. You will need to obtain the CRDP packet. See the link on our YouTube page. This will contain needles, an ear model, and a probe. You can provide your own orange for practicing body needling. We will be available for live online guidance and support both on an individual and a group basis. I want to emphasize that this therapeutic tool is intended for use by healthcare workers and for healthcare workers, your peers, and your colleagues. We aim to reach across the spectrum of providers who are working in the midst of this crisis and also those who are witnessing the damage from the sidelines and want to help. The CRPD can also be useful as a prelude to participation in conventional or group therapies. Please give us feedback about the course and about possible future teaching presentations. Future topics could include expanding your vocabulary of ear points to add greater flexibility and power to your treatment, learning to use an electric point finder, which indicates changes in skin conduction and resistance over active points, and finally, a deeper exploration of post-traumatic stress injury, its history, neurophysiology, psychology, and its management, and its many consequences. You've probably noticed me saying post-traumatic stress injury rather than disorder. Words are important, and the term injury is somehow less judgmental, more accurate, and closer to the truth of the matter. We're talking about several kinds of injury here: moral injury and betrayal, pathologic changes in brain processing and function, and end organ consequences of chronically elevated sympathetic nervous system tone and stress hormones such as cortisol. All are injury and result in injury. Something has happened, there is disorder, but it's the consequence of injury, not from some failing or deficiency or weakness. There are behaviors and mental states that are necessary and adaptive when under threat, whether in combat or in ER full of COVID patients. For example, hypervigilance, hyperalertness, and emotional distancing. These same mental states and behaviors can become maladaptive and destructive later on. And by later, I mean the same day later at home, or next month, or next year. The COVID-19 Rapid De-Stress Protocol specifically addresses the critical structures in the nervous system that are in play in post-traumatic stress injury. In normal circumstances, prefrontal cortex, hippocampus, amygdala, autonomic nervous system, and the endocrine system are all in continuous conversation, talking constantly to one another in a complex interplay of mutually facilitating and inhibiting messages. After prolonged and extraordinary stress, they're screaming, or not talking at all, shutting down. The CRDP can help to quiet or downregulate the system, bringing it back towards balance. Calming and centering, understood in this context, are not just pleasant suggestions. Rather, the words describe the homeostatic effect of this protocol on the brain and autonomic nervous system. The CRDP can help healthcare workers to cope and to heal. It's a very useful tool, and you can learn to use it and do a lot of good to ease the suffering of your co-workers in this crisis now and in the future. Please contact us with any questions or comments you may have, and thank you.